you joining us and really hope that you and your family are staying safe during this time. We know it's a difficult time, and we're all working hard to get through this together. So I'm really glad you've joined us tonight, and please keep in mind that BIST is offering all our programs on an online platform, so please continue to join us. I'm just going to give a quick bio. Certainly everyone who's speaking tonight is has been around in the brain injury world for a long time and has a lot of experience. So I've condensed the bios a little bit because it might take the entire presentation to go over all their experience and expertise. But our first speaker of the night is Jenn Bowler. Jenn has been working in the field of brain injury for over 12 years. She's a social worker at Sunnybrook Hospital, and she's also an assistant manager at Markham Stouffville Hospital. She is currently on our board of directors. And she's been involved in the BIST community for a really long time. She's assisted on our run committee and has done some volunteer work with us. And her area of expertise in practicing social work is with individuals with brain injury and their families. So we know it's a busy time for everyone, so we're especially grateful for all of our speakers tonight for taking time out of their schedules to join us. So thank you, Jenn. Our second speaker of the evening is Michelle Diamond. Michelle was the chair, she might be familiar to you because she was the chair of our BIST board and a member of our board for 6 years, I think it was. Michelle is a social worker and a case manager. She's also been working in the field of brain injury for close to 20 years. She did 10 years working in a hospital setting, and the past 9 years has been in the community. So again, thank you, Michelle, for your time and welcome. And closing us off tonight is Dr. Carolyn Lemsky, also a current board member. Very glad to have her on board. Dr. Lemsky is a board certified neuropsychologist who's been working in the field for 25 years, both in the States and Canada. I met Dr. Lemsky about 15 years ago working at CHIRS, where she's been the clinical director. So CHIRS is Community Head Injury Resource Services, which is a ministry-funded program that supports individuals with brain injury, both in the community and in residences as well. Also for the past 9 years, she's been the director of the Substance Use and Brain Injury Bridging Project. So again, all very well established and very busy individuals. So very, very glad to have them all on board. And Dr. Lemsky is also controlling our slides for us tonight. So thank you for doing that. So I'm going to put up my finger to switch to the next slide. Awesome. So just a quick review of the agenda. I'm going to talk quite briefly, but I do want to just talk a little bit about the BIST supports that are running right now, so to make sure people know that our services are still accessible. Jenn is going to talk about current procedures and protocols. Michelle will address the available supports and resources that are available to you. And Dr. Lemsky will chat about reducing anxiety during this very anxiety-provoking time. And then again, as I mentioned, we'll have an opportunity to share ideas and ask questions. So certainly we know that's important, and we'll leave a lot of time for that to happen. So just a quick overview. We did, I assume a lot of folks out there already know about BIST, but we did do some promoting of this event on social media. So just a quick overview for anyone who doesn't know who we are and what we do. So we provide free programs and services to people living with a brain injury, their families and caregivers. We're funded by donations, money raised at our events, and sponsorship programs. We are a nonprofit organization. Our mission is to enhance the quality of life for people living with brain injury through advocacy, awareness, education, and support. We don't require proof of injury. There's no formal intake process. Folks are welcome to come to our programs and check us out and chat about becoming a member of BIST. And all our information can be found on our website, which is www.bistca. And I'm going to repeat this number a few times while I talk, but 416-830-1485 is our info line. Sorry, next slide, please. Okay, so what are we doing at BIST right now? We are all still working. We are still available. Everything has moved to an online platform. So our support groups are all running virtually. obviously our community meeting is happening right now virtually. Our ABI info series is also happening virtually. Our community outing has become a community inning. So we're trying to do as much as we can and stay in contact with our members as much as possible. So bist.ca/COVID-19 is how you can get a list of all our programs and services that are running right now and to register. And I really want to point this out. Our info line, where you can call to get information about all our programs, is also acting as a warm line. So we know people are probably feeling the effects of social isolation. Even if you just want to chat, give us a call. We're happy to talk to you. That phone number will be answered between noon and 4 p.m. every day. However, please appreciate we might have quite a few calls coming in. So if you don't catch us, leave a voicemail and we will return your call as soon as possible. We are here to help with support if you need to problem solve getting resources, food, medications, any issues that arise through this. Please give us a call and we will try and help problem solve it with you. And then we'll also be around when Michelle talks. She's going to talk about some of the government supports and community supports that are available to you. We appreciate sometimes making those calls can be daunting for anybody. And it's nice sometimes just to have someone make that call with you. So that's another thing you can do. If you call our info line, you know, we can do a 3-way call and just be on the phone with you to support you through that process. One of the things we are helping with starting shortly is we have a volunteer who will help submit taxes. So he will do taxes online with you, walk you through the process. It'll be a shared screen, such as what we're doing tonight. And that way you can have a little bit of support when completing your taxes. So if you are interested in that, we'll put more information on our website. But again, you can give us a call or send us an email. And once our date and time of that clinic is confirmed, we will reach out to you and let you know. I'm going to pause for 2 seconds because I see questions. Okay, those questions, will answer all the questions at the end. I just want to make sure they weren't urgent. So next slide, please. This again, sorry, I know I keep repeating the number, but please know we're open and call us. The other piece I don't think I put here, but the Ontario Brain Injury Association is also fully functional and working on a virtual platform as well. So please, if you don't catch us, you can also reach out to OBIA as well. What I didn't say at the beginning is that we're recording this webinar and everyone can get a copy of the slides, and we will be posting this recording. So no need to frantically take notes on all our phone numbers. We will send this out to everyone who's registered, but that's just an overview of the staff who are currently working right now at BIST. Okay, I'm going to take just a few minutes tonight to talk about one of the programs we're running because it is very relevant right now. We did get a little bit of money at the beginning of the year from the Ontario Ministry of Seniors and Accessibility to do some work around financial abuse and fraud prevention, because we know everybody is vulnerable to frauds, especially during this time, as I'll talk about. So we wanted to make sure we had a bit of a platform and a bit of a toolkit to give our members and the community some information about fraud prevention. Sorry, Carolyn, next slide, please. And this is why I want to talk about it. So the Canadian Anti-Fraud Centre has put out a bulletin alert. And this breaks my heart, and it's maddening that this is happening, but whenever a crisis arises, scammers tend to come out. So as COVID-19 continues to spread globally, associated scams are coming out. We actually received an email, a couple of emails now, to the BIST email account saying that they had masks for us, and we got one saying that they were offering free tests. So if you're getting an email or a text message like this, please know that it's not valid, and I'll give you some resources as where to check that information. So just be aware. A good rule of thumb is that if you didn't ask for it, you don't want it. So if you weren't looking for any information that's coming into your inbox, being texted to you, you probably don't want it. So don't respond or click on any links or attachments that might be suspicious coming into your emails. Don't give out your personal and financial details. I'll show a video shortly where someone is impersonating impersonating Red Cross, saying that they have access to tests or masks. So anything like that that seems a bit suspicious, don't click on it. One of the things you can do, and we talk about this whenever we talk about fraud, again, unfortunately, whenever there's a disaster, fake charities tend to pop up. You can verify that a charity is registered. 211 is a great resource and a fairly easy number to remember. You can call BIST. We can help you search to see if that charity is legitimate, or there's a website here you can click on to check that it's legitimate. So all these things are available. We appreciate that people have big hearts and like to give what they can. We just want to help people make sure their money goes to where they want it to go. Always be suspicious of miracle cures, herbal remedies, emails coming to you about vaccinations or faster testing. Again, these are things that scammers are using to draw people in because everybody's feeling a bit anxious right now and looking for these types of things. And again, people are trying to offload cleaning products, hand sanitizers, and some of them might just be looking to get your credit card information. So just be very careful when you're purchasing stuff online. Sorry. These are some of we actually have a sticker that looks like this that we have at BIST, and we're happy to mail out to anybody who wants one. I keep one on my laptop. Some people keep them on their phones. Just a quick cheat sheet of how to know if it's a scam. We know sometimes you answer the phone and it does you feel very pressured right away. It might be the CRA, it might be someone from COVID, saying it's about COVID-19 and they have test results for you. Anytime you're feeling pressured or there's a sense of urgency, that's a really good sign that it's a scam. So hang up right away. That's, you don't have to do it. There's also people now going door to door saying that they have home testing kits available. Home testing kits do not exist in Canada. So if you get someone knocking on your door telling you that, I know we all want to be lovely and polite, but feel free to be rude and close the door on them. They're just trying to scam you. And then if you go to bist.ca/financial abuse or downloadable resources, you can order any of these products for free. We're happy to send them out. We've got a ton. So reach out and we'll send them out to you. And this is just a quick video clip if it works, just kind of driving home the point of the scams that are happening right now.
I'm not hearing any volume on the video. I'm wondering, Caroline, is the video turned up?
Can you hear it now?
Okay, I think what we can do, so we'll send this link out and I'll send the link to the YouTube video so people can watch it on your own time. And I think, Carolyn, you stopped it at a perfect spot. This is exactly what I was talking about. The text messages that are going out saying in response to the recent shortage, Red Cross will be giving out a free box of masks per household. Red Cross has come out to say that this is a scam. But even before Red Cross came out and did that, people were clicking on it and then it's trying to get your information. So, if you see something like this, before you click on it, you might want to go to the Red Cross website to see if it's legitimate. And you want to make sure also that you have antivirus software on your computer at all times, because unfortunately, sometimes when you click these links, that allows them access to your computer. So just things to be aware of in this time where unfortunately people are looking to take advantage of the situation. And again, these are just some links that you can look at that have legitimate information. So again, everyone will have access to these, but you can click on, the Public Health Agency of Canada, the World Health Organization, and they're going to give you the correct information about what's available and out there to hopefully prevent you from being lured into anything that's going to give you false information. And again, if you have questions, concerns, you've got an email, text you don't know, call us. We're happy to help. That's what BIST is here for. And just a little plug, we are doing a webinar specifically on financial abuse and fraud on April 1st at 2 o'clock. We can talk forever about this subject, so I don't want to take too much out of this time. I just wanted to draw attention to the COVID-19 scams, but please feel free to join us then as well. I will now pass it on to Jenn, who is going to talk a little bit about keeping yourself safe.
All right, so I will say as a disclaimer, this is my first time doing a Zoom webinar, so let me know if something doesn't sound right or if there's a problem. The other things I wanted to say is I'm going to give you some updated information about COVID-19 and different ways to keep yourself safe and healthy. But I want to be clear that I'm not a doctor, I'm not a nurse, and I want to make sure that, I'm not giving you medical advice. Every piece of information that I have in the next bunch of slides is either from Ontario Public Health website, Toronto Public Health website, Toronto hospitals, and that really, it's often changing. COVID-19 is new, and you probably are getting tired of all the different things that you're hearing sometimes on the news. So what's exactly told today might be even different in a week from now, at least in terms of some of the new findings. So just to be clear about that. So how can I keep myself safe and healthy? So what we know about COVID-19 is that it's spread through what we call droplets. So droplets being things from a sneeze or a cough or your spit or saliva from somebody who is infected. And you can get it by having direct contact with those droplets. What we also know is that those droplets can be spread up to 6 feet. So that's why you hear sometimes on the news, stay 6 feet away from somebody for that reason. Also, the droplets can land on a table. If I cough right now and I'm not covering my mouth, then they can end up on a table or they can end up on a subway pole, and they can actually still be live, or they could still infect somebody for several hours later. So in that sense, that's why you're hearing all these things about washing your hands in the news or on different ads. They're saying that washing your hands often is really one of the main things and one of the best ways to keep yourself safe and healthy. Soap and water for at least 15 seconds. Some places say 20 seconds. There's something out there that says if you sing happy birthday a couple of times, and that is the amount of time that you should be doing your hand washing. If you don't have soap and water because you're just not around it, you can use hand sanitizers that are alcohol based. I know Melissa just was talking about some of the scams that are out there. There's certain sanitizers that are more recommended than others, and I think it says 60% alcohol, but if you're not sure, I mean, you can always ask if you're at a pharmacy. Otherwise, just as I mentioned, the droplets can end up on a table. So if I'm touching the table and then I touch my mouth, or if I touch my eye, then I could actually get infected that way. So try not to touch your eyes, your mouth, your hand, your face with your hands, especially if they're not washed. We do it all the time. We do it unconsciously. We don't mean to, but that's something to try to be conscious of. If you know anyone who's sick, try to avoid close contact with them. If you yourself are sick, stay home. If you're coughing or sneezing, often we want to go, but then we're actually coughing on our hand. So better to cough on a tissue and then immediately throw out the tissue, wash your hands again. It's all about washing your hands, and then cleaning any objects or any surfaces and disinfect them as regularly as you can. And then you've probably heard something in the news called maybe social distancing, or the new term that Toronto Public Health just changed it yesterday is now called physical distancing. So I have, in my next slide in a second, there is a poster that I got from the Toronto Public Health website. And 2 days ago when I made this slide, it was social distancing, and they've now changed it to physical distancing. So really what they mean by that is so much as stay 6 feet away. You can see it on the bottom, keep a distance of 6 feet away if you have to be with other people. Ideally, you've probably heard everything. It says stay at home, stay at home, stay at home. But we realize that sometimes staying at home, you're still living with other people. Or if you do have to go out and do things that are absolutely essential, there's still people around. So the idea is, if as much as possible, keep your distance from people. We all know that the term social distancing, I think what threw sometimes some people off is that we still need to be social. And we're going to talk about some ways to do that. And this is what we're doing right now as a way to be social. But really, physical distance means that specifically. Keep a distance away from people. Oh, come back for a sec, I think.
Oh, sorry.
That's okay. Yeah, I think there's, yeah, I probably don't, you can probably go ahead, but there's some different examples on there. Stay home, we're doing virtual meetings, we're canceling group gatherings. If you don't have to go out of your home, don't. Even if you have a close friend or a family member, try to talk to them away from being with them. Talk to them on the phone, talk to them via video. Don't just say, I know that you're healthy, so come on over, because we don't know that all of the time. It's also a cold season, it's also flu season, it's allergy season, so we want to just be extra careful with everything that's going on right now. You can go to the next one. So there's a few more physical distancing tips that I wrote there. If you are going to go out, please bring some sort of hand sanitizer if you can. Wash and sanitize your hands before you go into any buildings. We were talking about grocery delivery options. There's certainly plenty of places that do that. What we've now learned is that because so many people are doing it, that it's a longer wait time than normal. So you want to plan ahead and make sure that you're not at the very, very end of your food and then going to do that. If you're going to go to a store, go during quieter hours, not maybe popular times, although in theory they should be quieter because more people are at home. Use a card, a credit card or a debit card instead of cash. If you're going to take TTC, again, try to take it during hours that might not be so busy. Spring is here and it's a lot nicer outside. So if you can go for a walk instead to where you're going to go instead of taking the TTC, you might want to get some exercise. It's really hard to be at home all day long. There's lots of creative ways to do exercise from home though as well. Something that we do when we meet people or when we say hi is we hug or we shake hands. So instead you wave to people. People are doing elbow bumps. If you happen to see somebody, still be careful about the 6 feet distance from there. And then I mentioned before, call or do a video chat with a friend, but basically stay home as much as you can. So, right, next. So, what do you do if you think you have COVID-19? So again, I can't give you any medical advice, but what we do know is that there are symptoms that seem to be very similar among people who do have COVID-19. So the main ones seem to be a fever, some sort of cough, difficulty breathing, and that could just mean it's a little bit harder or it feels like you've just done a run and you haven't done a run or you haven't just climbed a whole bunch of stairs, or that you might have muscle aches. So we also know that some of these symptoms are also the same as a flu, and some of them could be the cold. There are other symptoms that some people have reported, like being tired, having a runny nose, a sore throat. So the best thing to do is to call your family doctor or your nurse practitioner or whoever is your primary care provider. A lot of doctors and primary care providers aren't meeting people in their offices, but they're doing things like we're doing right now or doing phone consults. Otherwise, you can call Telehealth Ontario. I have heard from people that sometimes the wait time can be long or you have to leave a message and they'll call you back, but that is an option as well. There are also a couple of online tests, and I say be careful with online tests, but these are from public health websites or Toronto Hospital websites. There are different questions that you get asked, and then they try to give you as much as they can, some basic advice at the end. And I'm going to talk in a minute about COVID-19 assessment centers, but they are out there. But the recommendation right now from public health is that you don't visit one unless a nurse or a doctor has given you guidance to do that, or if telehealth has done that. Because if you do show up, not every single person is going to be tested. They have specific criteria and specific things that they're looking for and specific ways that they are going to help you make that decision. So by all means, you can certainly show up, but just to save yourself a trip, the best thing to do is call your family doctor or telehealth before then. Please don't call 911 unless it's an emergency. And we'll talk a little bit about what might be an emergency later or when to go to the emergency room. But okay. So what I understand is that telehealth and family doctors and others, they're often telling people to self-monitor or to self-isolate. There's lots of new words and phrases that are going around that people have never heard before. So we want to try to explain them. But basically, these are some of the things that are going around that public health and doctors are telling you to do. So self-monitoring basically means monitor, check yourself. So that might mean you don't have any symptoms, or you might just have a little bit of symptoms and you've called telehealth and they say, just self-monitor, check yourself for 14 days. If that's the case, do that. Try to limit your contact with others in the ways that we were talking about before, physical distancing. You want to avoid crowded places. You want to avoid public transportation. So you just want to be a little bit more careful, even though we're all supposed to be careful. And self-isolation, it sounds scary, basically means isolate yourself. It means try to avoid being around as many people as possible completely, even if you're living in the same home or area. And a reason that you might be asked to isolate yourself, could be because you actually have some symptoms, and they've said to do that. It could be that you may have been with somebody who has COVID-19. You might have COVID-19. You might have traveled outside of Canada in the last 14 days. The new thing today is that it is absolutely mandatory that anybody absolutely has to go 14 days. The government is even offering to help pay for people's transportations or other things so that they are not stopping at the grocery store, doing anything but going directly home or to a safe place. So if you're in self-isolation, you're not to leave your home, you're not to go to a store, you're not to go outside for a run, you're basically staying home away from people for 14 days. And if you do have symptoms, this is where they would say you could wear a mask, so that if I'm close to Carolyn or if I'm in the area of her, I'm wearing the mask because I have a cough and a sneeze. So it's really to help protect Carolyn, who is hopefully staying away a distance away from me. So I said I would talk a little bit about the assessment centers. A lot of the major hospitals in Toronto have assessment centers that they've created specifically because of what's going on. I've listed them there. They are not necessarily inside the hospital. They might be set up outside or in a specific wing of the hospital. And you can just show up as mentioned, although as I said, I've given you advice to get some medical advice before going. There's no cost to being tested at the assessment center. You don't need any OHIP. There's no charge. It's basically, if you go, they're going to ask you a bunch of questions and they make this decision whether or not to assess you. They may turn you away and they may say, please do this instead, or go home and monitor yourself. But those are the places that actually do have them. What they are saying is if you are a healthcare worker, if you work in a place like a group home or with people who, like on a home where older adults are, in a shelter, a jail, if you live in a group home or area, you might be somebody who they might choose to test a little bit more. So just be mindful of that. Okay. You can still go to the emergency room, but before they set up these COVID-19 assessment centers, people were going to the emergency room in large crowds to get tested. And so they had to set up separate places because there's still a need for emergency room for other types of emergencies. So again, not medical advice, but what they're saying is if you have some of the symptoms of COVID-19 that we talked about, a fever, a cough, a headache maybe, plus a more serious symptoms, like if you're really short of breath when you're walking or exercise, or even just sitting here if I was really short of breath, if I was having pain in my chest, if I was even really having problems getting dressed or showering or doing a meal with being really weak, If you're drowsy, if you're dizzy, if you're feeling a little bit confused, they would say, public health would say that that would be a reason to go to the emergency room at the hospital. Earlier I said the suggestion is please don't call 911 if you think you have symptoms. 911 is, there's lots of reasons for calling 911 even apart from COVID-19. But if you are especially having any major problems breathing, or if you're confused or you don't think you can get yourself to the hospital, then that's a good reason to call 911. So there are other reasons we go to the hospital. I can tell you right now from working in 2 hospitals that there are a lot of restrictions right now, and that the hospitals are still open for many, many reasons, but there's a lot of changes that are happening right now because of COVID-19. So if you have an appointment, you may have gotten a call to say that it's been changed to a virtual appointment like this, or it's been postponed. If you have an appointment, just double check to make sure that it's still happening. If you're not feeling well, please call to make sure that you should go. Sometimes they're going to say yes, but sometimes they're going to say, let's hold off. I can tell you at my 2 hospitals right now, when you come to the door, there are people there and they are screening all staff and patients and visitors. So they're going to ask a whole lot of questions about symptoms and if you've been traveling. And then they may even ask you to wear a mask when you come in. And they may actually turn you away if you have certain symptoms, and they may give you some other advice. A lot of hospitals don't have all of the entrances open. They may only have a couple of them. So you want to just make sure you leave extra time in case you need to go for a bit of a longer walk to the area that you normally would go when there's a shortcut. And right now, this is hard for many patients who are in the hospital, but only under exceptional circumstances are visitors allowed. So if you've heard that your friend or your family member is in the hospital right now, whether it's related to COVID-19 or for anything else, right now, most hospitals have no visitor policies unless it's very exceptional. So just, again, be prepared for that and think of creative ways of how you can support your family member or friend during this time. So I just put a funny joke in there. I don't know if any of you know Waldo, but there's those books, Where's Waldo? And it's that man in the striped shirt who is in the middle of crowds of people, and your job is to like squint and try to find him. So this is the Where's Waldo, social distancing or the physical edition. So we got to have a little bit of a laugh in a hard time like this. So I hope that was, oh, we can go to the next one. Similar information or similar places I think that Melissa had mentioned. You want to be very careful about where you're getting your sources of information. The media, newspapers, TV shows have so many different things, and sometimes it's very accurate, but sometimes not. So these Ontario Ministry of Health, Public Health, Toronto Public Health are very reliable sources. So I will turn it over to the next person.
Hi, everybody, and thanks again for joining the chat today. Thanks, Jen, for all of that information. Very helpful. I'm going to spend the next little bit talking about some practical resources, some questions that may have come up. And again, a disclaimer, I am not a financial planner. I am not a housing expert by any means. So the information that I'm providing, again, is information that's been provided from both federal and provincial websites. And I know that, you know, further to what Melissa was saying, there is going to be opportunity to speak with someone through the BIST office with respect to taxes, which is what I'm going to be speaking about in a moment. This first slide just talks a little bit about where we are right now. So we're in a storm. There is a storm happening right now, and we don't know when this is going to pass. So rather than waiting for the storm to pass, we're going to learn how to function and how to still have a quality of life, and we're going to dance in the rain. So the first thing I want to talk about is the World Health Organization talks about the social determinants of health and how all of these things are really important to making us feel our best. So, you know, the World Health Organization talks about the need for financial security, housing security, social supports, and access to health services, which altogether, you know, allow us to function as humans. And, you know, before the COVID, I know that we may have had some challenges with any one of these. But what I'm hoping to do today is give you a little bit of information on each of these 4 different aspects, just to really make sure that we're maximizing access to these services, and perhaps giving you some ideas, things perhaps you didn't know about, and just to share a little bit more information. So the first thing I'm going to talk about are financial support. So the next 3 slides talk about getting some financial support for people. And there's 6 different charts, and I'm not going to go through them all right now. This website is, or this webinar is going to be made available to you. But people are finding themselves in different situations. Perhaps they were working and they were laid off. Perhaps they have to self-quarantine. So what I want you to do is look at these different options. So the first one here talks about work closures. So was your work closed? Were you laid off because of that? These slides give you a little bit of information on what sort of category you fit under, and then how you go about accessing those services. So if your work was closed and you are eligible for EI, meaning you've worked 700 hours, you need to get a record of employment from your employer, which they should be able to give you. And then there's a phone number, and there's also a website that you can call. There's another one here, if you have to self-quarantine. So Jenn talked a lot about why you might be in that situation. So were you exposed to somebody? Do you believe that you yourself have been exposed or have COVID-19? Even if you don't have a positive result, because unfortunately the government just doesn't have capacity to test everybody, if you have done these self-questionnaires or self-assessments and you feel that you have to self-quarantine, you are eligible to apply for the EI benefits, so long as you've completed 600 hours of work, and you've waited the 1 week waiting period. Again, the phone number and the application is online for you. The next one is, were you laid off and you're not eligible for EI? So perhaps you hadn't worked the certain number of hours. You can apply for some supports that have now been set up. So there's emergency support benefits. As of the, I guess the date that this slide was provided, which was, I guess, within the last few days, I don't think they had confirmed exactly how much was going to be available. It says here that applications will be available as of April. So that is next Wednesday is April 1st. So keep your eye out for that. You'll have to go on the Service Canada website, and there will be a toll-free number and a website available for you to check off that information. The purple slide here, sorry, just back for 1 second. The purple slide here, again, if you're self-quarantined and again, you're ineligible for EI, meaning that you haven't met the work hours, a similar application where you'll apply for the emergency care benefit. On the next slide, there are a lot of individuals that are unable to work because the schools have closed. You're now at home taking care of your kids. Again, there are benefits available that will be noted as of April 1st. And then, do I qualify for WorkSafe benefits? I mean, have you been exposed to COVID-19 through a work-related exposure? Unfortunately, we're finding the news is sharing that initially most of the people that were infected were travel-related. There has been a lot of information indicating that there is now more community transmission. So people that have recently tested positive have been exposed through a workplace encounter. So again, there's a telephone number here, and at the bottom there's a website there that I'm sharing that you can look up just to give you a little bit more information, just to help people with some financial security through this indeterminate amount of time when people are not able to work. Okay, so let's talk about taxes. We are in tax season right now. So taxes normally have to be completed by April 30th, but the government has indicated that for those people that will have to pay taxes this year, there's going to be an extension, and you'll have until August 2020 to pay your taxes. For people that are eligible for the GST credit, it'll be coming in May of 2020, and basically every adult who qualifies is going to be receiving up to $300 plus an additional $150 for each child. For those people that are eligible for the child tax benefit, again, there's going to be an increase by $300 per child. So there is going to be an overall increase. What I would ask is, again, I'm not a tax expert, but just I hope this is providing you with a little bit of reassurance that You don't have to get it done by April 30th, that there will be an opportunity to, as Melissa said, there's going to be volunteer at BIST. There's going to be a website posted through the BIST website on getting information on your taxes. For those of you that do want to go ahead and pay your taxes because you believe you're getting a refund, the Government of Canada has indicated that electronic signatures will be sufficient. So if you are not able to sign a copy of your taxes, if you have somebody doing it for you and you're not able to get out and provide a hard copy signature, then you'll be able to provide an electronic signature and that will be accepted. For any of you that are students or that have student loans, there is going to be a 6-month interest-free period delaying your loans for people that are experiencing some additional financial hardship. There will be an interest-free deferment for paying your taxes. I'm sorry, for paying your student loans. I've got taxes on the brain. Okay, so let's talk housing a little bit. So housing is a difficult situation for a lot of people right now. You know, in addition to financial burden, we still have property taxes, we still have bills to pay. In Toronto, there is currently a 60-day grace period for payment of your property taxes, your water, and your solid waste utility bill. You can go onto the City of Toronto website just to get more information. For any of you that live outside the City of Toronto, I know that Peel Region has also indicated that they have, I believe, a 90-day grace period. But what I would suggest is go on your specific city and website, and you can get more information on that. What I have also read is that if you have set up automatic payments for your property taxes, there is a 60-day grace period, so you will not have to pay that right now. When you set up your online billing system, you may have assumed that you would have the money in the bank to pay those bills, but if you don't, there is a 60-day grace period. For those of you that have mortgages, the Canadian Mortgage and Housing Corporation is providing some flexibility for homeowners in terms of paying your mortgage. What you need to do is you need to contact your mortgage broker or your bank that you have your mortgage with, and you have to discuss that with them directly. All of the banks do have people working, so just go onto your bank website or call your broker and you can discuss that individually with them. There is still going to be interest that incurs on your mortgage that you will then end up having to pay over the course of your mortgage. But again, what this is designed to do is provide some temporary relief for immediate payments. I know a lot of people rent, and as of today, I did go back online just to check, and I know that there has been a lot of discussion. I know the Parkdale community has been really active in trying to lobby to get some rent relief for people that rent their homes. And right now, there isn't anything specific in place, but I'll continue to liaise with Melissa and keep the information, as updated as possible. Unfortunately, right now, there is nothing. I know that a lot of people have spoken directly with their landlords and discussed some kind of payment, perhaps partial payments. So I would encourage you to do that if that's an option. But I do know that the City of Toronto is in talks with trying to provide some rent relief for individuals that are renting right now. Next. Okay, so one of the other determinants of health is talking about social supports. And Jenn was spending a lot of time talking about social distancing or physical distancing. It can be a lonely time. It can be an isolating time. For many of us, we are living on our own, and with family, and that in itself is quite stressful. They may not be the best social supports for us, so it's really important to stay connected. So there's lots of online platforms, picking up the phone, calling people, using social media, using your Facebook, your Instagram, your FaceTime. Calling someone is good, but I think seeing someone's face can also be a real breath of fresh air. So I certainly encourage everybody to use that. That being said, I want to caution people that sometimes too much news and being too connected can also be a little bit dangerous. Jenn was speaking about, getting your news from and your information, and Melissa as well, from getting your information from reliable sources. So I would encourage you to get your information either from the news or from reliable websites rather than what your friend posted on Facebook and that there's a miracle cure or, what I've been seeing a lot lately is, Advil versus Tylenol. I know that seems to be a big question that's coming up and people are debating it. And these are people that are by no means medical experts. So if you have questions about specifics like that, you can go on to the Ministry of Health websites and really get your information from reliable sources. The other thing is be mindful of when you're getting your information. This can be really anxiety provoking. There's a lot of unknowns. There's a lot of speculation. And so I would encourage you to not, or to limit the amount of television or news that you're getting before you go to bed. It can be really difficult for many of us to get restful sleep if we are ruminating on all the what ifs and all the unknowns. So, someone that I was working with had said they give themselves, 1 hour when they wake up in the morning. They don't read anything. They don't listen to anything related to COVID. They watch, videos of cute puppies or cats, whatever it is, that puts a smile on their face. And then before bed, they do the same thing. They listen to some relaxing music and they really try to practice good sleep hygiene and limit the amount of news and sort of bad and gloom and doom that's inundating them so that they can get a restful sleep to help them deal with all the other challenges that we simply just don't have that much control over. Next slide. Okay, so this idea of practicing self-care is really important. And this MAPS analogy is taken from a psychiatrist, Joshua Rosenblatt. He posted this March 19th of this year, so I want to give credit where credit is due. And he talks about MAPS, which is a really nice analogy for talking about self-care for ourselves. We need to take care of ourselves. We are on our own, many of us. If we do have friends or family or a rehab team that we're still working with, the amount of interaction we have with people is going to be reduced. So we have to take care of ourselves. So if you remember this MAPS analogy, it'll help you go through a different, perhaps a daily routine. So the first thing is mastery, accomplish something. So this is something that allows you to feel a sense of accomplishment, something that you've completed a task. Sometimes, we spend all day in our pajamas and we just feel like we're not doing very much. So make sure every day you are mastering something. And it can be something as making a sandwich, cleaning out a room, sweeping the front porch, completing some work for school, doing something where you go to bed at the end of the night and you said, I did that. The next one is altruism. Do something for someone else. It makes us feel good. And that can be something as reaching out and making a phone call, sending an email. Hey, just checking in. How are you doing? Something that lets somebody else know that you're thinking about them, you're hoping they're doing well, they're feeling loved, and perhaps that will help someone else feel a little bit less isolated. P stands for pleasure, doing something for yourself. It's essential when people are feeling sad or anxious. It almost seems, counterintuitive. You don't have the motivation or the desire. This is where you really need to push yourself and do something that's simply for us. It might seem a little bit self-indulgent if it's eating an ice cream sundae, but it's something that makes you feel good. Sometimes it might feel like you're faking it a little bit, but when you do it, it feels really good and gives you motivation to continue on with other tasks through the day. And then the S stands for silence. And we need to give ourselves opportunity to quiet our brains. And that's when I was talking a little bit about limiting the information that is being thrown at us in so many different platforms. Settling your brain is taking some time for yourself, for some quiet, for some music, going outside, getting some fresh air. It's spring, there's birds out, some nice sunsets, really just trying to quiet your brain. And the way you do that is to limit external stimulation and just give yourself some time to rest. So the last slide I'm going to talk about is accessing health services. So Jenn did a really good job of talking about, the medical connection to the COVID-19. I'm going to talk a little bit about some of the other things that are happening for us. So with regards to accessing health services, the Ontario government is extending the validity period for driver's license, license plates, Ontario photo cards, even health cards. Don't worry about it. Even if they're expiring or they have expired, you're still going to get the healthcare that you need. There's been, a delay on all of this. We can't go and access these offices. So don't worry, you will get it done, but it won't limit you from accessing services. If you have medical or vision reports that need to be submitted for, different applications, you can speak with your healthcare provider. They will have access to these forms. They can submit them on their own so that the information is still processed. But if there are deadlines, so if, say, for a license renewal, you need to go and have a vision assessment done by a certain amount of time, all of these extensions are being granted and accepted. If you're applying for things like CPP, ODSP, Ontario Works, you can contact your healthcare provider to complete their portion of the medical form, which can then be submitted to the appropriate office separately from your application, or they can scan and send it to you. But I would ask that you reach out to your healthcare provider directly, and they can answer and complete that information for you. So I think that's all I wanted to say, and now I'm going to pass it over to Carolyn.
Myself. Hey. So I'm really looking forward to Melissa coming back and getting the chat from everybody about the things that they've done that have really been successful in getting through this time. And we were just sort of talking before we all got started in the webinar, musing over the fact that likely we're talking to a group of really resilient people who've used their resources to get through a difficult time in the past. So I'm looking forward to hearing about that. We're getting a lot of advice in the news, and I think Michelle's already talked a lot about some very good advice that we frequently hear with the MAPS acronym. But one of the more entertaining ideas that I thought came out recently were to ask the experts who have a lot of experience in physical isolation, and also in situations where they're really depending on a lot of other people to keep them safe, where there's a lot of variables that may seem difficult or perhaps even life-threatening if you think about going into space. And how do they remain calm and happy and mentally healthy even when they're out there in a spaceship? And I know in my own life I'm thinking that that's really not a bad analogy for what's going on these days. So some of the experts from, and there have been a few articles on astronauts, here we have Chris Hadley, is that it's really important to set a routine every day. And along with the information that Michelle was just giving, setting the routine and setting goals, even if they're simple goals around the house, can really help you to feel accomplished and encourage a sense of control. Stay in touch with folks, just as Michelle was talking about. And then here's where state of mind comes in. We tend to look for the things in the environment, the things that catch our attention, is sometimes related to what what kind of a mood we're in. So if you're in a funky mood, you kind of look for or notice more the things that are going wrong. And so sometimes in a stressful moment, you really have to make a very conscious effort to look for the things that offer just even moments of joy. So it's what positive psychologists will call gratitude. And in fact, when you really stop and think about it, there is a lot to be grateful for in our everyday life. I mean, if you have a particularly yummy snack, if you have the company of a pet that you enjoy, if there's a little bit of sunshine and you can hear the birds sing, all of those little moments that we notice can really help you to shift your mindset. And something that Michelle was talking about that is really so important, although maybe we're a part of the problem now in this webinar, is to limit your intake of media. Early in this adventure, I was really hungry for all kinds of information that I could get about COVID-19. And now more recently, I'm really kind of seeing the wisdom of letting the statistics be and really focusing more about what I have control over in my immediate environment, making sure that I'm washing my hands, making sure that I'm doing what I need to do, and then trying to take a break. Consciously doing things that are enjoyable, that get me outside of the situation, like reading a book or watching a television show, doing a meditation. There's also another little trick that I use when I'm starting to feel a little panicked. And it's something that actually is research tested, and I think in my own personal experience is really kind of tried and true. Just calling yourself by your own name and giving yourself a little third person distance can really be helpful in putting you in the mindset of a helpful friend. It can give you just that a little bit of emotional distance that you need to really cope more effectively. So for me, when I'm really feeling back up against the wall, I can kind of say, Carolyn is in a really tight spot. What could Carolyn do to be helpful to herself? Carolyn really needs to stop and think. And just by that simple twist of language, I can kind of give myself enough emotional distance to really think things through and use my best judgment. Oops, gotta go back up here. And the other thing, and this is sort of, it's a simple idea that isn't always easy. And everybody has their own approach to this. And recently, some of the things that I've been reading have given me some inspiration of things that I might share with y'all that can be ways to look for the bright side, to look for things that are hopeful and optimistic while you're being bombarded with what is objectively a difficult time. So for me, one of the big bright spots is having an opportunity to do things in the house that I hadn't made time for before. I'm often distracted on the weekend by getting out and doing things and even shopping. And this has been a real opportunity to get some of the closets cleaned out. So for me, that has been a definite a silver lining. So is there something that you're maybe doing a little more of now that you enjoy that actually was a positive side effect? I'm even connecting, I think, a little bit more remotely with family than I had in the past. Another little kind of sort of mental game that I play that I find that's really helpful is thinking ahead about how I'm going to tell the story, maybe to my grandnieces and nephews, about what it was like during the pandemic in 2020. And I think about, what do I want to say? And I think I'll probably, because I try to have a sense of humor, want to remember some of the weird, funny, and touching stuff that would make my story interesting. Just like, we heard about the people in Italy who got out on their balconies and were singing to each other. We've had some neighbors trying to wave at each other across the street and have conversations that way. There was a bagpiper outside of a nursing home trying to shed a little joy. And I think for me, one of the weird little things might be trying to plant seeds, which I haven't had much success for, just to keep myself a little bit busy. The other thing is that I know myself, and I'm going to want to tell a story that I'm proud of. And so when I stop and give myself that little bit of emotional remove and think to myself, what would I want to say to someone about the creative and ingenious things that I did to stay busy? The weird recipe that I had to make from the leftovers in my fridge. Maybe somebody that I helped down the hall. What strengths did I discover in myself? And just recently, in kind of using that sort of third person story kind of strategy, I was thinking about connecting with my neighbors and how our dogs were running back and forth between the fences. We were getting a little bit worried about social distance for the dogs running back and forth. But in thinking about it, we were both we were all thinking about how much support that we're providing with each other, how we're being creative, and how we're really trying to work for the public good, staying away from each other so we can slow the spread of this silly virus. So those were some of the ideas I had. And so I'm looking forward to Michelle, or for Melissa to talk a little bit about some of the ideas that everybody else had. This, Melissa, is your resource slide. Did you want to speak to this?
Sure. Hi, everybody, again. Thank you to all our speakers, first of all, for all of that amazing information that was shared. I do see there are a lot of questions coming up, so we will get to those and answer them. And as Dr. Lemsky shared, and as we all encourage, we are very cognizant of the facts that our community meetings up until last week were really a place where people could congregate and hear information, but also share their stories and share with one another. So please, we do welcome you to share anything, even if it's just an antidote of something that's happened to you over the course of this social isolation, or if you have any ideas or strategies, the chat box is there, it's open, and we will absolutely be reading those out. So I just wanted to reiterate that fact. We just put together a resource line. We will put all of this up on the BIST website as well. But again, any of the resources that Michelle shared, that you hear about in the news. Again, I know as Michelle was talking, I think I saw something come in that something she was talking about had already changed. So we know these things are changing rapidly, and I will address that in a second. So please call BIST, and we're happy to help you find the most current information. 211 is just a really good number to remember. They have a website and a number. I was chatting with them yesterday, and they've actually increased their resources. Obviously, they are having to keep up with all the agencies such as ours and what is available right now, which again is changing rapidly. So 211 is your best bet to call if you need food bank information, community supports, crisis lines. 211 is 24 hours a day, 7 days a week. They do have some different languages available. You can call them and access this information. And then, of course, there's some crisis lines and warm lines that you can call from mental health issues, distress lines, and again, warm line that you just want to chat. You can call BIST during the day. And this warm line is by oh, I'm losing my train of thought. It's not Providence, Progress Place. Progress Place is open every night from 8 p.m. to midnight, which of course, BIST unfortunately is not open during those hours. So that's just another place that you can call to chat with somebody. I think that was the end of our slides. And I'm going to start opening the questions. Hold on one second here. My screen just got smaller. Okay, there we go, I fixed it. I'm going to start with the chat, and then I'm going to move to the questions. So I think somebody had asked for the link to our COVID-19 response. So Ryan has very lovingly answered that. So if you go to the chat, you'll see it, bist.ca/COVID-19. And there was another question about our warm line. It is open Monday to Friday, 12 to 4. Again, we are answering it at that time. If it's busy, it just means we're on another call. Leave a message and we will call you back. So one of our members identified that the 1 week waiting period, I think that was for something Michelle might have been addressing. The federal government got rid of it, but because of being flooded applications, we may need to wait. It's a good point. Thank you for updating us. Again, this information is changing quite rapidly. Oh, and one of our members is sharing another good resource, the Big White Wall. So on BIST's end, we will look into that and put it on our resource page, but thank you for sharing that Big White Wall. It's a mental health resource online. That's quite good from one of our members, so thank you for that. Please continue to throw stuff into the chat. I'll keep checking it, but right now we're going to go to the questions and answers. Oh, I see. So 2 of the questions Ryan had answered. How to use a face mask properly. Wiping public phones, don't share cell phones. That's a good tip. For the face masks, Jenn, do you have anything you want to add about that? I don't think that I'm quite qualified to answer that question.
Hello again. So the question is how to use a face mask properly, is that correct?
Yes.
So the question of face masks, there's all sorts of different things in the news about it, about them, as well as different countries are doing different things. So what we do know is what I mentioned before about COVID-19 and how it's transmitted is that it's called droplet. It's by your droplet. So if you cough or you sneeze and it gets on somebody else, or you're touching something and then you touch your mouth or your eyes. So for that type of transmission, I don't have a mask here because I don't wear a mask outside in public right now. It's like that regular basic surgical mask. It's hard for me to explain without having one here. And at this moment, what public health is saying is that if you yourself have a cough or a cold or a sneeze or something that you might be transmitting, then it's appropriate for you to wear the mask. And it's the kind of mask that it hooks over your ears and then goes here and then over your ears here. The other aspect of that mask is it's really only good for about a certain number of time before, if it gets wet or if you're touching with your hands and other things. What I think a lot of people are confused about or wondering about how to wear or to use are what's called N95 masks. And that's a whole other type of mask. And I can say to you that in the hospital, we only use them for, oh, look, Michelle has one. So sometimes construction workers, oh, Michelle. So the one that Michelle is holding in her left hand is the surgical, it's kind of like a surgical mask. Yeah. And then you pinch it around your nose, etc., like that. You want it to be under, make sure it's as tight as you can be. There are a couple of sizes for those, but they're not necessarily specific. But those are the ones that if Michelle had a cough right now or sneeze, that would be recommended that she wears it, and then you do your hand hygiene. A lot of times people are wearing them thinking it's enough, but then you're touching it and you're touching other things, so it actually defeats the purpose. The other one that she had is the N95, which the public health is saying that even hospital workers aren't wearing them for COVID-19, except for very, very specific procedures and things. And to be quite honest, I'm just going to make a plug right now to say that a lot of hospitals and healthcare workers don't have a lot of masks, or they're concerned that they may run out if COVID-19 continues to spread the way it's spreading. And yeah, there's different ways in which you can specifically wear that. But yeah, there's different straps.
One thing, Jen, sorry, the one thing that I would just add to this, and again, as a community provider, we have had, and the reason why I have these masks is because I do have to go into hospitals sometimes. And so we've been provided basically with one of each of those, which I'm sharing today, is if you do go into a hospital setting, you should be disposing of it before you get into your vehicle, because you just don't know what the exposure has been. If you want to wear it while you're outside for a walk, if you yourself are someone that would be considered high risk, if you have, if you're prone to upper respiratory issues, if you have diabetes, if you have other immune suppressed symptoms, then you may want to wear it. And then, as Jen was saying, you could potentially use it again. But if you are wearing it into an environment like a grocery store or a public place like a hospital, they really should only be worn once and then disposed of. If you're wearing gloves, take off the mask first while wearing the gloves and then dispose of your gloves.
And then wash your hands. Yeah.
And then wash your hands.
Mm-hmm. Yeah. So I think public health is not stopping people from wearing like the surgical masks, and some people are saying they're wearing them because they're afraid. It's a reminder not to touch your face or doing those things. I think the main thing, and maybe this is where the person asked the question, is that they're not being worn correctly, or they may not be protecting you in the way that they think that you think you are being protected. So.
Great. Thank you so much, Jen. We do have a lot of questions coming in, which is great. Thank you, everybody. Just please be patient with us. We will get to all the questions. I'm going to put two together for an answer. So we had one member saying that he is an ODSP recipient, also a BIST member, and he's stuck if he should pay his rent or purchase food. Another member asked, said Ontario announced an aid package today that included benefits for children and seniors. Was there anything for ODSP recipients? The news didn't say. So in terms of both of those, I can tell you what we do know. As you know, we have a worker who works quite closely with Ontario Works. And what we know is that you, right now, if you need extra support, whether it be for food, transportation, accommodation, their offices are not taking people are not able to walk in. They've shut down some of their locations. That being said, you can always reach somebody by phone. So it might not be your worker. And if you call your worker, you will get maybe a pretty long voice message, but in that voice message, they will tell you who to call. And what we've been told, and I was just looking on the government website, they are being a little more lenient with what they provide people. So if you do need something, they're encouraging you to contact your ODSP worker. If they're not available, listen to the message and contact the person who's taking their place right now and explain your situation. And they're taking anyone who calls their requests very seriously. And being more accommodating. Again, if it's around, cleaning supplies you might need, again, transportation, money for food. So I would suggest your first line is to contact your ODSP worker and see what you can get. If you're still stuck in a situation where you're not able to access food, please give BIST, our helpline, a call, and we will also try and work with you and see what else we can help you with yet.
One thing I just wanted to add with regards to housing is, if there are any current eviction orders pending, the government has put a halt on all of that, and they're also not going ahead with administering any new eviction orders at this time. So if you are currently subject to eviction, rest assured that you will not be evicted during this period. I can't tell you exactly when that is. So the question of, do I pay my rent or do I pay my food? That's a really difficult question. And it's an unfortunate situation to be in. So, I would encourage you to perhaps speak with your landlord and see if there's opportunities of delaying or partially paying. And then with regards to food, I don't know about food banks. I don't know if they're open right now, but perhaps, with the types of foods that you're buying, perhaps making different choices at this time and buying things that are packaged or frozen that, might last you a little bit longer, again, to get us through this difficult time.
There are a few initiatives that I've become aware of in one of them in Scarborough. We might be able to get these up, that are trying to actually do food deliveries during this time, that are food banks. One of them is in Scarborough, and it's Scarborough Food Security Initiative. I'll try to add it to the slides before the slides are posted so that folks will have access to that information.
Great, thank you. One of the things we do know at BIST as well is that unfortunately, if you weren't already connected with a food bank, some of the food banks are not currently doing intakes. But again, if you need help sourcing out that information and addressing that, please give BIST a call and we can work with you individually on that. The next comment or question here is, when I last checked, grocery stores were charging expensive rates for delivery. Have any been lowered? Which one is most affordable? And is BIST advocating with public health and governments to get them to lower them if they haven't? It's a good question. To be honest, I couldn't tell you right now which one is the most affordable. I don't know if anyone else on the panel has insights on that. At this time, BIST has not been advocating for lower prices, simply because we've been a little busy organizing, moving on to our virtual platform. However, we do encourage anyone who is having issues with this. Certainly your MPPs are still running, their offices are open. certainly we invite you to advocate, do some self-advocacy around that. But BIST will certainly do a little bit more digging around in terms of grocery store delivery prices. And we can share any information that we find with BIST members. So thank you for that. The next member is sharing that she was well prepared for the COVID-19. So thank you so much for sharing that. If you have any tips on what you did to prepare so well for it, please send those in and we'd be happy to share those with our members as well. Okay, another member said, could BIST do a link for mindfulness and breathing practices that we can use, or possibly do a group mindfulness session online like a group chat? Yes, thank you so much. Any other suggestions like that, please send them. We would very happy to share links like that. So we will put that on our radar. We will share some, and I will talk to Ryan, who's our programs coordinator, about seeing if we can coordinate a session around that. So thank you. I really appreciate suggestions like that. Okay, another member. My father is a 60-year-old survivor of a subarachnoid aneurysm. He requires a lot of care in maintaining his mental health and having a consistent routine in care. I am his caregiver and his daughter. Not being allowed to see him during this time with no date when I will be allowed back, I fear he will decline. I have been diligent in providing him with neurorehabilitation, and the facility cannot provide his level of care. What can I do as a personal caregiver to provide him with what he needs during this time? It's a very good question. Does anyone on the panel have anything they want to comment on for that?
I can comment. Oh, sorry. I can just comment again, you know, as a community therapist, this is something we've been struggling with for many of our clients who are in group residential environments, whether it's long-term care, whether it's retirement home. And I would say every facility has their own limitations. I think the biggest thing is having access to PPE, which is the protective gear, and there's 4 elements to it. So it's gloves, gowns, masks, and face shields to protect sort of, you know, any cross-contamination. So, you know, what I would encourage, you know, this member to do is to reach out to the facility themselves and find out if they have access to those services. Again, you know, what we want to do is eliminate risk of people declining in health. We want to keep people out of the hospitals. We want to keep people away from their family doctors if there's things that we can do. And as this member was saying, you know, mental health is a big component of somebody's well-being. So, you know, I would encourage everyone, if you have this situation come up, is do reach out to the facility specifically and find out what their current policy is. If there is a current outbreak or if there's a current exposure on their in their facility, then they're likely going to be not flexible at all. If they're just concerned about risk associated with that, then maybe speak with them about discussing using that full PPE gear so that you can come in and provide those supports. The other thing we've been doing is reaching out to the staff in the facility and arranging for the use, you know, for many of these individuals, they don't have their own cell phones or iPads with them, but perhaps arranging a time when you as a family member can FaceTime with your family member, can connect with them by using perhaps the cell phone of, you know, one of the staff members there so that you can stay connected. Those are just some of the strategies that we've been using to try to, you know, reach out to these individuals.
Thank you, Michelle. See if anything's been added to that. No, okay. So our next question that came in is there any truth to hand sanitizer altering the pH level of your skin, making you more susceptible to the viruses? Again, I don't feel qualified to answer that one. Does anyone on the panel have any information about that?
So far as I'm aware, there isn't any formal information about that, and it does live on moist surfaces and on the skin, but it's not as dependent on pH. If you think about what it takes to kill a virus, which is 30 seconds of contact with alcohol, It kind of gives you a sense for what a virus can live through. And so, I think what we're all doing is taking the normal precautions that we should be.
Yeah, and I would say that public health says that soap and water and that 15 to 20 really good hand washing, and there's a lot of parts of the hand that actually don't get hit, is still better overall than hand sanitizer. It's just that practically, if you're out and about, you don't have a sink and soap with you. Yeah, and as mentioned earlier, the hand sanitizer, the Center for Disease Control and Prevention is recommending a certain amount of alcohol for it to be really effective. So I know that
over 60%.
I know that doesn't totally answer the question, but it is also advocated from them to be using it. So.
Great, thank you. The next question that came in is it necessary to wear a mask and gloves outside? Is it safe to go for walks outside? Is the virus airborne? And do we know for sure? In terms of going for walks outside, right now, as I understand it, what they're saying is going for walks outside, not in crowded areas, making sure you're keeping your 6-foot distance from anybody else who might be out. So not going to crowded places like boardwalks, beaches, parks where there's a lot of people on the trail, a lot of joggers out. So if you are going for walks, and I think everyone acknowledges that it's important to get fresh air and physical activity, especially when you're starting to feel maybe a bit anxious and wanting to get out, but just doing so in a way that's safe so that you're reducing your contact with other people, because that's the bigger concern right now. In terms of wearing a mask and gloves outside, that's not something that I've heard of, but again, I will defer to the panel if anyone else has any information about that.
I think the official line right now is that both masks and gloves might provide a false sense of security, and they won't take the place of good hand hygiene and an effort not to trust your face, to touch your face. The virus, they've been studying the virus in a lot of different situations, and you might see reports that it remains airborne for quite a period of time. Those tests were done in a medical environment, doing specific procedures like suctioning, where that makes the droplets particularly fine, and that makes it so that they'll actually float in the air. That's not a normal human condition. And so by the time the fluid that would contain the virus would get 6 feet, it would actually sort of be on the ground. It would have dissipated. So your all indications are that you're safe to go outside if you're keeping good social distance, and to remember not to touch things and then touch your face, and to use hand washing and hand sanitizers outside the home.
I would just say in the hospital, if we do have a patient who is COVID-19 positive, and just to be clear, many patients or people who are COVID-19 positive are in self-quarantine or self-isolation at home. But for the patients who are at the hospital or who are suspected, as healthcare workers, we're not wearing the masks that we be considered for airborne. We're wearing that first mask that Michelle showed, which is the surgical mask, and the gown and the gloves. And there's a very, very specific order that we use them. And we have somebody who is there to ensure before we go in to see somebody that the PPE, the personal protective equipment, is put on correctly. So I can say to you, in the hospital, we're not considering it to be airborne, and we're not wearing those masks except for the very specific procedures like suctioning or putting a breathing tube in somebody. There's specific ones. So.
Great, thank you. The next.
One of the things that, we want to be careful of is these supplies are in short demand, and we want to make sure that the people that need them, like the, first responders, that the staff in hospital have access to these. So the messaging is that you don't need to be wearing these when you're going out for a walk. people should be avoiding public spaces anyways. They don't want people ordering and hoarding these items so that they can go for a walk and then, as someone was saying, that false sense of security, saying, well, I have a mask on, I can now go out to a public place. They really want to make sure that these masks are being used by the individuals who are providing care to those that are positive or that are sick. We use these masks for more than just COVID-19. They're used when there's any kind of, risk of infection. So I think that's the messaging that we're hearing from, public health and from, the health minister, is that you don't have to be wearing them, and really everybody shouldn't be trying to get them so that they can be used for those people that must have them.
Great, thank you, Michelle. Just a note, if you are putting stuff in the chat box, it's not showing up on my screen for some reason, but I was just checking in with Ryan, you'll see his name on the side, our programs coordinator. He's gonna cut and paste those into the questions and answers. So anything that's going into the chat will be read, just to be aware. So we have another question coming in. My client was asking about a relief fund. Do you have any information about that? I guess my question around that is what was the relief fund looking towards? And I want to say two things about it. So the first is there was a scam email going around, trying to remember if I saw it yesterday or the day before, saying there was a relief fund, $150 for any Canadian, regardless if they were still employed. And that was a scam. So if it's that relief fund, no. But if it is a relief fund in terms of any of the things Michelle was talking about, if someone is no longer working, whether or not they're entitled to EI benefits, I'm just curious what the relief fund is that they are looking for. So maybe if you are still online and able to just post a little bit more information in terms of what the relief fund is, if it's for someone who is maybe been told they need to socially isolate themselves, or someone who is told they can't come into work, or they're no longer able to work. And then I think we can probably better direct that answer. Again, everything that was shared in this webinar, including the pieces Michelle talked about the different financial supports available, will be shared. So if you're not able to write back, hopefully you'll find that information in there. And if not, you can again contact the BIST line. The next question is, what about government aid for those of us not on ODSP but on CPP disability and still below the poverty line? Is Ontario Feds or a city providing something? Is BIST going to advocate for universal basic income payments, which people are calling for? So again, I have not heard of any additional benefits other than what I just talked about in terms of if you are on Ontario Works or ODSP. BIST is regularly gets updates and provides support to the income, sorry, I always forget their name, it's ISA, I was just pulling it up on my phone. ISAC, so the Income Security Advocacy Center. So they did send out a bulletin actually pretty much right before this webinar started. So I will take some time to go through that. And in it, it is talking about what has changed in terms of the benefits and what is being advocated for. And what I might do is copy and paste portions of this and share it on the BIST webpage, which will hopefully answer some of those questions. I haven't gone through it yet, but it did just come in. So I will certainly get that posted. And the next is a comment. Oh, thank you. One of our members who had said she was well prepared for the outbreak has written in to say what she had done to prepare for the outbreak. So thank you for that. I'm just going to read it out. I was well prepared for COVID-19. The first thing I did was change the self-isolation to homecation. Very good tip. It's like a staycation, a homecation. Her daily routine, she kept it. 6 a.m., wake up, morning coffee, prepare meal for the day. 8 a.m., perform my physio exercises and other activities. 9:30, spent 90 minutes doing my online course, Infectious Disease and Infection Control and Intro to Biology. 11 a.m., big breakfast. 12 to 2 p.m., social connections. 3 p.m., 20 minutes outdoor walk with my PPE, 4 to 6 p.m. quiet time, 6 to 8 p.m. webinar. Thank you for joining us. I also declutter a small area every day to accommodate my disability and visual problem. Meditation before bedtime. My new normal is kind of cool. Thank you. Thank you for sharing that. I think that's really nice for people to hear what others are doing. And I love that idea of just reframing it. I think some of us feel like we're stuck or being punished or maybe grounded like we were as teenagers, but reframing it to a homecation is a really nice way to put that. So thank you for sharing that. Anonymous attendee advised that his or her Rexall pharmacy delivered medication for free, FYI, so just sharing that as a resource. And I do believe a lot of the pharmacies are following suit and delivering medication for free, so thank you for sharing that. And then another attendee is just giving credit to Jenn for what she was saying in terms of washing hands is the recommended mode to keep your hands clean and sanitized over hand sanitizer. And they sent us the guidelines, so we will have a look at those and we will post and share them as well. Is there a list on the webinar or public available of those who are most at risk? Example, asthmatics, diabetes, etc., just to create more awareness to highlight who is more at risk. Does anyone on the panel want to take this? I can advise what I know, but I think my scope might be a little limited. So my understanding is what they keep saying is anyone with underlying medical concerns is more at risk. I don't know that there's a broader definition, so it is a really valid question is what exactly is an underlying medical condition. Certainly my understanding, people with respiratory diseases or suppressed immune systems are certainly more at risk. They don't have what others have in order to help fight it off. But that's something certainly we could do a bit more research on it and share with the group.
Some folks who are taking medicine for autoimmune problems, like steroids, who have suppressed immune systems, it's something to ask your doctor about. But I think that, and there are a lot of red risk folks on the one hand, but on the other, I think we have to really keep in mind that for 80% of us, it's going to be like the normal flu. Mm-hmm. And that really is, I find a comforting thought. I'm going to be doing everything I can to keep from getting infected. But we have to keep remembering that all of these precautions that seem so stringent and rigid is not because of the huge danger to the majority of us. It's so that we can support our healthcare providers and those folks that are most at risk to keep that virus down to a minimum. So one of the things that I try to remind myself is I'm doing all these things, kind of a civic duty, more so than trying to protect myself, although being safe is important. It's important to keep the risk in kind of, the personal risk in kind of, in context with the societal kind of risk. Does that make sense?
Yes, thank you.
Okay.
Question, will you send us the slides? Yes. So we will try and do that tomorrow, if not by the end of the week. We'll send out the slides, and Ryan is recording the webinar, as I mentioned, so we will also be sending out the video as well, so people can watch it again. Again, I just want to be very much aware of the fact that, as we've said, information is changing. So unfortunately, if you watch this webinar on Friday, some of the information, such as what Jenn shared about what the hospitals were doing in the COVID assessment centers, that could change. It's a bit out of our control. Things seem to be changing on an hourly basis. Even as Michelle was talking, some of the resources were changing. So the information is the best that we have at this point in time. So please, rewatch the slides, rewatch the video, whatever you need to do, but just be aware that unfortunately by Friday, it might not be the most up-to-date information, which is why we would encourage you to go to the websites that we provided, Toronto Public Health, the World Health Organization, just to get the most up-to-date information there.
Melissa, I just wanted to jump in for a second and just comment on the, the who is at risk. And I see there's a comment that came in from another member saying people with brain injury, are we considered to be at higher risk? So, I want us to remember that this is a virus. I'm not a medical expert, but what makes us as general population more susceptible is when we get run down, when we get tired, when we're not eating and taking good care of ourselves. So while somebody with a brain injury may not, I wouldn't want to say with broad strokes, everybody with a brain injury is more susceptible, but I think thinking about what are the symptoms or what is the impact of your brain injury. So for example, if you experience some cognitive issues or memory issues and you forget that you should be washing your hands, or you forget that, you shouldn't be touching your face, I think those are people that potentially could be higher risk. But to say someone with a brain injury would be higher risk, I don't, again, not a medical expert, and I would defer to the panel to add in, but I don't think the very nature of having a brain injury makes you more susceptible. If you have difficulties with sleep and you tend to get more run down and you're not taking good care of your overall health, you could be susceptible to the flu, to the cold, to any kind of virus. So that's why we were talking, all of us were talking about maintaining, the good hand hygiene, trying to eat as well as you can, get exercise, and do some self-care, some relaxation for your mental health. That's what's going to help keep you as safe as possible.
Mm-hmm. Absolutely. There isn't anything about having had a brain injury itself that would make you more susceptible to the virus. It's all of those other things that you were talking about. I did take the liberty of answering one question, kind of back channel. Somebody was commenting that they feel sometimes paralyzed by their anxiety and not wanting to go outside, and maybe using some of the protective equipment to feel better, to go outside. Maybe that's something that even started before all this began. And I think the general wisdom there is do what you need to do to feel comfortable, to get out and to feel well. And the other thing is to take advantage, to reach out to some of the hotlines and warm lines that you have access to. And the other thing too is when I'm kind of coaching somebody over the phone who's feeling kind of paralyzed, the most useful strategy has been that third person thing. Talking to yourself in the third person like that really does have this impact of giving you a little bit of emotional remove, and realizing that being afraid is not the same thing as danger. We can be very, very afraid and be in no danger at all. And so sometimes when you're kind of talking to yourself in the third person that way, it's easier to realize, my body is doing something that makes me feel really afraid, but you know what? I'm looking around and I'm actually okay here. This house right now, I'm safe. So Carolyn is safe. So, and again, if you're feeling really kind of in a panic, a little bit of talk is helpful, but doing too much venting can sometimes keep us a little stuck. So reminding ourselves to express what we're feeling and then move on to the coping strategy, or even sometimes the best coping is just distraction, and getting on with it. That was it.
Excellent advice. Thank you. I'm just going to change it up a little bit because I'm going to try and mix some of the questions with some of the suggestions from our members. So one of our members sent in a couple of tips, and I like all of them. If you need fresh air, and I'm assuming this is and you don't feel maybe safe going out for a walk, which is something that people feel, use your balcony or window. So you can do that instead of maybe going outside. So that is one tip from our members. And the same member, in terms of anxiety, if you're starting to feel anxious, and I do this, sing a happy song. So go to your happy place, sing a happy song, sing like nobody's listening, dance like nobody's watching. Those weren't her words, but that's good.
But that's good advice.
Yeah. So thank you for sharing that. It's very much appreciated. Going back to the questions, Do you have any suggestions on how to handle, treat groceries that are brought into the home? Very good question. I'm going to see if anyone on the panel wants to take that one, and if not, I will jump in.
It was a slapstick comedy routine when my husband and I were puzzling over that same problem. We were so careful in the grocery store. What do we do when we get them here? And I think ultimately what I did was I looked at some research that showed that the virus does not live long on cardboard, and most of the things that you get are cardboard. So what we ultimately decided to do was to bring things in bags, leave them in bags exposed to the air in the house for a period of 24 hours, which is apparently what was more helpful, wipe them off and put them away. And that seemed to be in keeping with some of the other suggestions that we got. I don't know that there's any good, the other solutions really require having a spray bottle with alcohol, and nobody can find the alcohol in the store. That becomes more available, having a spray bottle that's a solution that's essentially 60% isopropyl alcohol, and just sort of spraying it, leaving it in contact should be really good. The other thing we did was we sort of wiped down with with whatever we had, anything that was plastic, let it dry, washed our hands, and kind of called it a day. What I've noticed is that a lot of folks in the grocery stores are using gloves to handle the product, everything in the store. And produce, when you bring it in, actually a good rinse and doing your normal sort of produce hygiene will actually remove the viruses. It should be okay. I don't know. It's not an official answer. It's just sort of like what our coping has been in this weird time.
Yeah. No, I think that's a great answer. I think we're all trying to figure it out. It's nice to hear that you did the research and
just a little
way. But yeah, and again, I might want to defer to the public health website to see if they have any information on that, and certainly will check it out as well. But I hope that answers the question for now. Thank you, Carolyn.
Yeah, there might be an update. We were looking all over and we didn't see much.
Yeah, and kudos to public health for keeping up with everything. Again, I think we've all acknowledged that things are changing quite rapidly, and for everybody to keep up, especially government agencies, has been really incredible, the work that they've been doing. So certainly know they can't get to everything all at once, but I'm sure the information is forthcoming. Can anyone confirm if OW is still taking applications? Would there be a risk of them not accepting it because of COVID-19? So everything OW is doing is over the phone. So you can contact your local OW office, and if you need help finding that office, you can contact BIST and we will help you. You can go to their website and type in your postal code, and it'll tell you which the local office is. Again, if that office isn't open, there will be a voicemail that directs you to one of the places that are open, and then you can be screened by an OW worker there. So as far as I'm aware, and up to today, we are still doing some work with OW, there hasn't been a pause on Ontario Work applications, so you can still contact their office for that. And I'm just gonna, Ryan is being lovely and just taking pictures of the chat box for me. I just want to make sure I haven't missed anything. So one of our members has given us more advice, so thank you to all the members sharing. This is exactly what we were hoping for, that people would put in things that they know and things that they're doing, because we appreciate that this is normally a time when you would be talking to one another. And our support groups, just so you know, will be set up a bit differently, more like meetings where everybody can see each other who's there and can participate. Unfortunately, when we have 40 members, that's not possible for us to do. So there still will be a place for that. But I do appreciate you all taking the time to write in. So one of our members has let us know that the city has closed all parks and off-leash areas. Only places left to walk are the streets, keeping 2 meters apart. So yes, thank you so much. So again, keeping in line with stay away from busy places. Now parks are closed. keep to your streets, and stay away from anyone else who might be having the same idea and wanting to go for a bit of a walk as well. And that was everything from the chat line. Ryan, if you're there, I'm going to ask you to jump in if I've missed any of the chats. The very last question we have here, and I don't know the answer to it off the bat. I don't think so, but the question is, does citrus kill COVID-19? I'm going to go out on a limb and say I don't think so, which is why we're all being very, very careful with what we're using, washing our hands, using the hand sanitizer. If it did, it'd probably be a really nice thing. If citrus did, we'd run out of oranges instead of Lysol wipes. But if anyone else on the panel wants to speak to that, please do.
I don't think we do. Yeah, just to add to that, I don't think we do know. This is such a new illness, such a new infection, and that's sometimes why the information is changing based on what we're learning and what scientists are doing and doctors and such. So I believe they're working on vaccines, and we're hoping that we're going to get to that, but I haven't heard anything about the citrus.
Great, thank you. And the very last comment, I will read it out because I echo this to all our speakers. Thank you also very much for doing it. It's definitely appreciated. So thank you, anonymous attendee, for saying that. And again, on behalf of BIST, we thank all the speakers who came out tonight and volunteered their time to share what they know with you. So thank you. Ryan, are you there? Is there anything else that I've missed that I can't see on my screen?
Hey there.
Hey, Ryan.
Yeah, just one other comment, more of like a preventative, protective measure. Hello, everyone. I've been hiding in the background. From one of our members, yeah, just to wear eye protection so you don't touch your eyes, and to wear gloves so you don't get infected.
That's great. Thank you. I like the glasses idea. That's a good one. I am prone and very conscious while we're doing this webinar that I'm not touching my face. But I think having some glasses on would help me with that. So thank you. All right. Well, I think that concludes our webinar for tonight. Again, thank you to all the panelists who came out to share their knowledge. Thank you, Ryan, for helping to monitor and take care of the technological part that I'm not good at. And again, I hope everybody out there stays safe and well, and please keep in touch with BIST. We're certainly here to support you. All right, good night. Oh, if people are still there, a positive note. I was getting restless during the webinar. I got up, walked in place. She did 5,000 steps. Well done. That's awesome. All right, good night, everybody. Thank you. Oh, Ryan, you might have to end this.